President, there are reports that we may be having a vote next week under reconciliation, dealing with the healthcare system of this country. We know that our colleagues have filed a new bill, but it is basically the same bills we've seen in the past, but this time even more consequential to our healthcare system of the people of this country. Now, I mentioned first the process because this bill has not gone through any regular order. It has not been referred to a committee for consideration. It has not been marked up or debated in our committees. It is going to be supposedly brought up as an amendment with us returning to reconciliation. So let me first explain what that means. That means that there will be no chance for us to offer amendments to the legislation. That means there'll be no opportunity in our committees to mark up legislation or to get the cost of the legislation or the technical help we do in doing any bill, let alone a bill that affects a large part of our economy. The presiding officer and I both serve on the Senate Finance Committee that has jurisdiction over health care. We're not going to have an opportunity to get the expertise help from our staff to look at the consequences of the Cassidy Bill and have a chance to work on it to make it work. Instead, what is going to happen if the game plan goes forward, this bill is likely to be on the floor next week during budget reconciliation, where a simple majority will be able to pass it. There'll be no chance for debate on the floor because we're at what's known as a vote-a-rama, and we'll be affecting 1/6 of our economy. That is not the way we should be operating. I'm also told that it will be done without a Congressional Budget Office score. Now, that's unconscionable. We know that for previous Congressional Budget Office scores on the other proposals that have been brought out, that tens of millions of Americans would lose their health insurance coverage. Premiums would increase by, some cases, 20–25%. It was certainly information from our objectives staff that caused many of us to say, what are we doing? But at least we had that information before we voted. We're now being told that we may get a one-liner from the Congressional Budget Office giving us the bottom line impact on the deficit, but not the specific information as to how many millions of Americans are going to lose their coverage and what is going to happen with those of us who currently have insurance with our premium increases. This is not the way we should be proceeding. It retreats against the progress we've made against the abusive practices of the insurance industry. Under this bill, as I understand the Cassidy Bill, each state could basically set up its own rules for how they wish to have coverage. The entire Medicaid system in this country would be block granted and would be capped. So the federal government would be getting out of the Medicaid business. The states would be given greater flexibility on how to operate the exchanges in their state and would no longer be subject to the same national requirements. And that means, for example, we all pride ourselves that we eliminated pre-existing conditions. But in reality, if the state determines what benefits are going to be covered and under what conditions, pre-existing conditions come back. That is something we should not ever allow to happen. And yet, under the Cassidy Bill, we are going to be telling people that we may not be covering their mental health needs. We may not be covering the opioid addiction problems. We may not be covering maternity benefits. We may not be covering pediatric dental coverage. We don't know what the plans will be offered. Today, we know under the Affordable Care Act we have these national protections, that everyone's on a level playing field. So a state could design a plan that would be totally unaffordable for people that need the coverage because they isolate the group in such a small number. That is not what we should be doing. It would provide inadequate coverage. Let me explain what I mean. I had a family came to me, a young family, and they told me about the circumstance of their child being born prematurely with significant challenges. They said that if that child would have been born before the Affordable Care Act, that parent's policy would have reached their lifetime cap within the first year. And the family would have had to make some horrendous decisions on how to take care of their child. That's why we passed the protection against annual and lifetime caps. That could return again under the bill that could be brought to the floor next week. I know circumstances where families have been able to get preventive health care and discovered cancer at an early stage. That coverage wasn't there before the Affordable Care Act. There's no guarantee that coverage will be there afterwards. We could return again to bankruptcies. It was the leading cause of bankruptcy before we passed the Affordable Care Act was health care costs. And now we're going to say because of inadequate coverage and lack of coverage, American families are going to be faced with taking care of their family, running up bills, and ultimately facing bankruptcy. We're going to be affecting people's lives, make no mistake about it. But the real tragedy of this proposal, why it's so different than some of the others, is it's an abandonment by the federal government of the Medicaid system. It would have draconian cuts to the Medicaid system to the extent that it would cripple it. It would make it ineffective. The states would be unable to respond. It's interesting, we just got a letter, Mr. President, from 10 governors in our country, 5 Democrats, 5 Republicans. All these governors said, no, don't do this. We can't do what you're asking us to do. We would have to make horrible decisions on whether we're going to continue to provide long-term care to our seniors, or whether we're going to expand coverage, or whether we're going to narrow benefits, or whether we're going to cover prescription drugs, or whether we're going to cut providers and they may not be able to treat Medicaid patients. These are decisions the states are going to have to make if this bill ever became law. It affects so many. Some of the things that maybe is misunderstood about the Medicaid system is that veterans, 1.75 million, are in the Medicaid system. Quite frankly, their coverage has never been enough, and the Medicaid system has helped fill the gap. That's going to cause a problem for our seniors. I'll just give you one example. You know, we pride ourselves in federalism, and federalism to me is very important. I served for several years in the state legislature, former Speaker of the Maryland General Assembly. And I pride the fact that Maryland has been an innovator in health care. They've been able to do that because of the partnership between the federal government and the states. That's federalism. It's worked. If this bill or amendment were to become law, the Cassidy Bill, it will prevent the states from innovating. It's not giving them more flexibility. When you don't give them the resources and tools to deal with issues, you can't. Example, Maryland. We have what's known as an all-payer rate structure for hospital costs in Maryland, regardless of who covers your insurance, whether you're Medicare, Medicaid, or private insurance, or you pay on your own. You pay the same rate in my state for hospital care at the same hospital. It's an all-payer rate structure. We don't have cost shifting, and we don't have charity hospitals. And therefore, we have hospitals that are located in all of our communities. It saves the federal government money, it saves the state government money, and it's proven to be more cost-effective. The state experimented, and it worked. And the federal government has partnered with us. Can we continue that program if we get these draconian cuts in Medicaid? The answer is no. Can we continue this program if we see the uninsured rates bloom in Maryland because of the people losing their health coverage under this bill? The answer is no. You can't do this if the uninsured rates go from 6% to 12% or 15% of uncompensated care in our hospitals. That's what's at risk with the Cassidy bill. It really is, to me, also an affront to federalism in that you're putting states versus states. I'm in a state that did Medicaid expansion. The Cassidy bill has been scored that will cost my state $2.1 billion. I know that our legislature doesn't have that money. I know the governor doesn't have it. They just recently went to the Board of Public Works and reduced the state budget because they were running a deficit, and they're not allowed to run a deficit. They can't possibly cover the $2.1 billion. But here's the tragedy, another tragedy of this bill. The tragedy is that some states do much worse than other states. Why? Because Maryland expanded Medicaid, as did many other states, and therefore we got more federal funds because we had more people in the program. That seems fair. We're covering more people. But the Cassidy bill takes away from those states that expanded coverage, and we lose more. I thought this was the United States. I thought we were all in this together. The people of Maryland are proud to help the people of Texas or Florida because of the hurricane. And now you're coming back and saying you're going to hurt the people of Maryland because we did the right thing on Medicaid? Is that what this country's all about? Is that the United States? Is this body going to condone that type of discrimination against states? I hope that's not the case. So, Mr. President, I hope for many reasons, on substance and on process, that this bill is not brought up. Let's return to regular order. I heard Senator McCain say that so eloquently on the floor of the Senate. For the last 2 weeks, I've been working with my Republican and Democratic colleagues to come up with bipartisan ways to improve our health care system. We've made progress. We have some good ideas to stabilize the individual marketplace and to bring down the cost of health care, working together. And guess what? If we succeed in regular order and bipartisan, we'll not only do the right thing so people have stronger protection, but we'll also have policy that will stand the test of time and give predictability to the healthcare system of this country. That's what we should be doing in the best tradition of the United States Senate. So I urge my colleagues, let's work together and let's reject this proposal. Let's not bring it up. Let's go continue our work on a bipartisan basis. Certainly don't use reconciliation. Let's work together for the people of this country. With that, Mr. President, I would suggest the absence of quorum.